Welcome everyone to GW. My name is Liza Ebbets and I'm the current Administrative Chief. I'm joined by John Badalahi, who's our current Outpatient Chief, and Carl Quesnell, who's our current Inpatient Chief. We're here to tell you a little bit about DC and the things that you can expect when you come to GW. The current population of DC is a little over 700,000 people living in 8 different wards. Throughout these wards, there's much diversity of race, culture, and socioeconomic status, resulting in a breadth of patients that we serve.
There are plenty of things to do in DC, including cultural events, shopping, festivals, restaurants, outdoor activities, museums, and the zoo. DC's central location makes it easy to go to the beach, the mountains, or other large cities if you want to get away for a weekend. There are a variety of different neighborhoods that residents live in, and the mild weather with 4 seasons makes DC a wonderful place to call home.
GW Hospital was founded in 1824 and is a Level 1 trauma center. As one of the newest and most technologically advanced healthcare facilities in DC, the new GW Hospital building opened in 2002 and has 385 beds. There are over 800 physicians and 600 nurses who work at GW.
My name is Dr. Ben Borja, and I am the Residency Program Director. A trainee in our department can expect personal growth and professional development in a supportive and collegial climate of education and training in a carefully planned sequence of experiences which are didactically rich, well supervised, and focused philosophically on each individual within a biopsychosocial model. Through our long-standing affiliation with the Children's National Health System, we consistently attract applicants with a strong interest in child and adolescent psychiatry. Our unique opportunity to rotate for up to 4 months on the inpatient child and adolescent psychiatry units provides residents with a depth of experience suited to those interested in this subspecialty. Our affiliation with Inova Fairfax Hospital in Northern Virginia provides a range of outstanding training opportunities for residents, as well as one of our nation's oldest and most highly recognized fellowships in psychosomatic medicine. The department continues to collaborate with the GW School of Public Health and Health Services, the only school of public health in the nation's capital. We are one of the few programs in the country where psychiatry residents can complete an MPH degree during their residency program. Our 3rd-year fellowship in health policy at the Milken Institute of Public Health is a unique experience among our nation's psychiatry residencies. So in addition to the breadth of experience that we provide in inpatient settings, we also collaborate with more than 10 different outpatient clinics to provide our residents with a robust outpatient education tailored to their specific interests.
The guiding principle for our psychiatry residency at GW is the idea that psychiatrists have skill sets for treating symptoms of mental disorders, but extending beyond that broadly for relieving human suffering of many forms. We teach our residents evidence-based skill sets for treating the symptoms of major psychiatric illnesses, but beyond that, much of the suffering of our patients is due to loneliness, demoralization, alienation, just the sense that I don't belong, social exclusion of stigma. We train our psychiatrist residents not only to treat the symptoms of disorders, but also to relieve suffering that extends beyond just psychiatric illness. We say that brains have symptoms, humans suffer. We want to be able to treat symptoms with evidence-based practices. We want to be able to relieve suffering that extends well beyond the symptoms of illness. The calling card of our residency is diversity. Diversity of our patient population, diversity of our residents, diversity of our faculty. There's 186 countries, 100 languages represented in Fairfax County, one of 4 school systems in our region that have over 100 languages. Half of our residents had families that lived in some other country 1 or 2 generations ago. Our faculty focuses on global mental health. We have research programs in over 15 countries. Our work is known throughout the country with refugees, with immigrants, with survivors of political torture. Everyone who finishes this program is a skilled psychopharmacologist, but they also know how to use language and relationship therapeutically through a variety of modalities. If you're in Washington, that means that your local news is everyone else's national news. All the major issues of importance are here. If you do great things in Washington, it resonates across the country. It's a great place to train if you want your work to have impact.